Diabetes mellitus. Diabetes mellitus is a clinical syndrome characterized by hyperglycemia due to absolute or relative deficiency of insulin. Absolute or relative deficiency of insulin. Absolute deficiency due to reduced insulin secretion from beta cell, and relative deficiency due to reduced insulin action or insulin resistance. Now, investigations of diabetes mellitus. Investigations of diabetes mellitus. WHO diagnostic criteria of diabetes mellitus. Number 1, patient complaints of symptoms suggesting diabetes. Symptoms of diabetes such as polyuria, polydipsia, polyphagia, weight loss and weakness. Polyuria, polydipsia, polyphagia, weight loss and weakness. Number 2, blood sugar level. Fasting blood sugar greater equal 7 millimole per liter or 126 milligram per deciliter. And random and 2 hours after breakfast plasma glucose. Random blood sugar and 2 hours after breakfast. 2 hours after breakfast should be greater equal 11.1 millimole per liter or 200 milligram per deciliter. Number 3, HbA1c level should be greater than 6.5%. One abnormal laboratory value is diagnostic in symptomatic individuals. 2 values are needed in asymptomatic people. 2 values are needed in symptomatic patient. Now, physical signs for long-term complications of diabetes mellitus. Physical signs for long-term complications of diabetes mellitus. Food examination will find diabetic foot and gangrene. Peripheral pulse will look for peripheral vascular disease. Eye examination, diabetic retinopathy and cataract. Orthostatic blood pressure, postural hypotension. Orthostatic blood pressure or postural hypotension. Now, heart rate variation to bedside exercise. Fixed heart rate in autonomic neuropathy. Carotid root, carotid artery atherosclerosis. Now, neurological examination, find peripheral neuropathy. Bedside urine examination, find proteinuria is in diabetic nephropathy. Proteinuria in diabetic nephropathy. How will you evaluate and manage a 45-year-old newly diagnosed case of diabetes mellitus? Evaluation of patient by clinical examination, investigations of comorbidity. Clinical examination and investigations of comorbidity. By clinical examination includes number 1, pulse, blood pressure, to identify whether there is presence of hypertension, then weight, peripheral pulse, bowel and bladder habit, then dermatome sensory loss, any burning sensation of the feet, any burning sensation of the feet, then food examination. Investigations of the comorbidity. Clinical examination, investigations of the comorbidity. Investigations of the comorbidity includes hemoglobin percent, ECG, HbA1c, serum fasting lipid profile, serum creatinine, urine RE, 24 hours urine examination for microalbuminuria. Clinical examination and investigations of comorbidity. Treatment. Treatment include dietary modification, discipline and drugs. 3D. Dietary modification. Approximately 50% of new cases of diabetes can be controlled adequately by diabetes alone. Then discipline, lifestyle modification, exercise, cessation of smoking and alcohol. Drugs include oral anti-diabetic drugs or oral hypoglycemic agent for type 2 diabetes mellitus, and insulin for type 1 and type 2 diabetes mellitus. Type 1, only therapy with insulin. Type 2 diabetes, when combination of drug treatment is failed, pregnancy, complications such as diabetic ketoacidosis, hypoglycemic acute MI, stroke, chronic complications of diabetes mellitus, patient undergoing surgery. In that case, we will use insulin. Common insulin preparations, human insulin, types of insulins, two types. Number 1, human insulin and insulin analogs. Human insulin, short acting regular insulin or soluble insulin. After intermediate acting isofen, Arlo, R and blended. short acting, intermediate acting. Insulin analog, rapid acting and long acting. Rapid acting Lispro aspart, Lispro aspart. Long acting Glargine, Detamir and Digludec. Glargine, Detamir and Digludec. Indications of insulin therapy. Indications: type 1 diabetes mellitus, uncontrolled type 2 diabetes mellitus, diabetes with complications, diabetic ketoacidosis, diabetic neuropathy, diabetic retinopathy, hyperosmolar, hyperglycemic state, diabetes with stroke MI. Gestational diabetes mellitus, peroperative and postoperative diabetic patient, diabetes with severe infection, diabetic patient after road traffic accident, hyperkalemia as insulin increases uptake of potassium ion into cell, hyperkalemia. Common side effects of insulin therapy. Side effects: number 1, hypoglycemia, weight gain, peripheral edema. Insulin treatment causes salt and water retention in the short term. Insulin antibodies, local allergy, then lipodystrophy at injection site, at injection site. Oral anti-diabetic drugs or oral hypoglycemic agent. Oral hypoglycemic agent. Insulin secretagogues, insulin sensitizers. Then newer drugs. Insulin secretagogues, insulin secretagogues A. Sulfonyl urease, first generation, second generation. First generation tolbutamide, fluoropropamide and tolazamide. Tolbutamide. Second generation glibenclamide. Second generation glibenclamide or glipizide, glipizide, gliclazide, glimepiride. Glipizide, gliclazide and glimepiride. Sulfonyl urease, meglitinides, repaglinide, netaglinide. Repaglinide, netaglinide. Insulin sensitizers. Insulin insulin sensitizers, biguanides, metformin, fenformin not used now due to lactic acidosis. Biguanides, thiazolidinediones. Example: pioglitazone, rosiglitazone. Pioglitazone, then rosiglitazone. Pioglitazone and rosiglitazone. Newer drugs. Three newer drugs: alpha glucosidase inhibitor, incretin mimetics, then SGLT2 inhibitors. Alpha glucosidase inhibitors include acarbose, miglitol. Acarbose, incretin mimetics, dipeptidase 4 enzyme inhibitors. Linagliptin, vildagliptin, sitagliptin, saxagliptin. SGLT2 inhibitors: empagliflozin, dapagliflozin, canagliflozin. Empagliflozin, then dapagliflozin, canagliflozin. Diabetic complications. Complications of diabetes mellitus. Complications of diabetes mellitus: acute complications or emergencies, and chronic complications. Acute complications include hypoglycemic coma, diabetic ketoacidosis, hyperosmolar, hyperglycemic state, lactic acidosis. Chronic complications: microvascular and macrovascular. Microvascular complications: retinopathy, cataract, impaired vision, nephropathy, renal failure, peripheral neuropathy, sensory loss, pain, motor weakness, autonomic neuropathy, postural hypotension, gastrointestinal problems, gastroparesis, and altered bowel habit. Foot disease, ulceration, and arthropathy. Then macrovascular complications are coronary circulation, cerebral circulation, peripheral circulation. Coronary, cerebral, and peripheral. Coronary circulation: myocardial infection or myocardial ischemia or infarction. Cerebral circulation: transient ischemic attack and stroke. Peripheral circulation: claudication and ischemia. Claudications and diabetic ketoacidosis, diabetic ketoacidosis. Diabetic ketoacidosis, না diabetic ketoacidosis. Management of diabetic ketoacidosis, clinical features, symptoms, diabetic ketoacidosis,